So there are a few different things that we need to do. And one of them is to get everyone on board. And the most important everyone is the community.
Hi, everyone. I'm Joaquin Beltrán. I'm the creator of Speak Up America, and I'm here with Yaneer Bar-Yam.
Hi, I'm the president of the New England Complex Systems Institute and the founder of End Coronavirus so that we can get rid of this disease.
All right, so get rid of this disease. So we know we can get rid of this disease, but the question is how, right? And so End Coronavirus has been focused on this goal. So Yaneer, please share with us, how can we get rid of this disease?
So there are a few different things that we need to do. And one of them is to get everyone on board. And the most important everyone is the community, because the community is really responsible for the actions that are needed in order to get rid of this disease. So governments can say that they want the community to do things, but the community has to make the decision that it wants to do it. And government can also support the decision of the community, and that's really important. But again, the community has to do it. And the community doesn't actually have to wait for government to make the decision. The community can do it by itself. So that really makes a lot of the responsibility on the community to make the decision. But in addition to everyone in the community, it would be great to have companies and institutions, medical institutions, of course, and also indeed the government to help with many of the things that government can help with. Government should be indeed representing and helping the community. That should be what it's for, after all.
Absolutely, absolutely. I mean, government should represent the people and be on board with the people, right?
That's right.
Um, so that's excellent. Now let's look at the next step to getting rid of this disease. You mentioned mass social distancing and lockdowns on your How to Win guidelines. Can you go more into that?
Sure. So the main idea is that these are all the things that we have to do in order to prevent transmission. When we don't know where the disease is, and we need to worry about that people are going to infect each other. And we know what those are, because people infect each other by breathing the same air, by touching surfaces in common. So we basically want people to stay apart. And in order for them to stay apart, they have to know that they shouldn't be close to each other. And 6 feet is really not a number. It should be more than that, you know. And then, if you know, anytime you're near people, you should be wearing a mask. And indoors is much more dangerous than outdoors. And so we have to wear masks and try to ventilate places and so on. And again, try not to be near other people as much as possible. So there's social distancing or physical distancing, there's mask wearing, and there's you know, when you really want to do this and make sure that people are not near each other, there are these stay-at-home orders. But the main purpose of the stay-at-home orders is not to be at home, because you can be out and walk around. It's just to be away from other people so that you don't catch the disease or transmit it to them when we don't know who has it.
I think that's a great point. I think a lot of people, view the lockdowns as like, hey, suddenly you have to be, locked down in your house. But I remember you mentioning the example that if everyone went camping,
Right.
for a week, right, that would cut transmission of the virus,
Absolutely.
right?
If everyone went by themselves for 2 weeks, we wouldn't have the disease anymore.
Yeah.
So
I,
that's really important. Yeah.
I think that's a great example to put this in context and how to go about this in a smart way. So the next thing you mentioned on the How to Win guideline is testing and isolation.
Sure. So the main thing is, what do we do if someone gets sick? Because we want to be super, super careful that they don't transmit it to others, and especially not transmit it to their family and housemates. So what we need to do is, if someone has symptoms, we could just say, okay, you have symptoms, we don't know if you have the disease, and isolate. So that would require isolating a lot of people, because testing is often like 5% positive, which means that for every 20 people that have the disease, only one person will have symptoms, only one person actually has the disease. So the trick is to do testing. And so we need good testing to see if people are sick. And so right now, PCR testing is the test that people often use. The problem is that it often takes a while to get the results back, and it's not super accurate, right? So there are about 30% false negatives. So about 1 in 3 people are told that they don't have it, that have it. So you still have to be really careful, be based upon symptoms and isolate is, but the best thing is to use a test that you get results back immediately. And now there are some faster tests that would be really good. And there are other tests like lung imaging that are ultrasound and CT scans that can help really get results quickly. And basically the idea is you get tests and then you want to isolate people. And to isolate people, you want to really take it very seriously. And if you can't isolate safely at home, you have to isolate away from home. But if you have to isolate away from home, people have to, have to be taken care of, even if they have mild cases. They need support. And so we need the ability to help them. And it's really good to have the community help with that. Like we said, everyone on board means people helping each other, and setting up isolation and mutual help really makes that possible. And then there's also the contact tracing and isolating, quarantining of close contacts so that if they get sick, then we prevent them from transmitting it. So that's all of the sequence of things that happen if someone has symptoms. We don't know if they have the disease, so it's test, tracing, isolating, quarantining, and really taking care of people, making sure that they are not transmitting.
Yeah, really important. And, we're continuing to do better, but we're far behind from where we need to be. In California, they recently dedicated about $80 million towards isolation facilities for the sick.
Right.
But clearly we need a lot more,
Yeah.
to happen,
And we
throughout.
need it to happen fast,
Absolutely. Yeah.
because the transmission happens in the first few days and even before you have symptoms. So all of this stuff has to happen, boom. So you really want to make sure that people, even when they have very, very initial symptoms, they report it, or we check with them. Maybe you're not feeling well today. And that way we can take care of it so that they isolate super fast.
Yeah. Yeah. And something that I remember a lot that you mentioned is that, the greatest way spread happens is within households,
Yeah.
right? And so, having these things prevents that. So let's go on to number 5. Or actually number 4. You mentioned travel restrictions. Can you go into that?
Sure. Well, travel restrictions is about protecting communities. So if you have communities that have less disease than other communities, then we don't want to import it from other places. But even any travel between communities is going to add to the transmission. So what we want to do is limit travel to essential travel. It doesn't mean that you can't do essential travel, because the essential travel is much less than all the travel. And those who engage in essential travel obviously should be super careful. So we need to create awareness that traveling from place to place is creating risk of undermining our efforts to get rid of the disease, or if we've gotten rid of the disease, undermining our efforts to open up, and to be doing normal things. So what we want to do is we want to be safe and not do non-essential travel and have everyone take care.
Yeah. And I see that places that have done pretty badly early on with the disease, like, the tri-state area, right? New York, New Jersey, Connecticut, they've implemented that. And it's
Yeah.
helped keep their numbers down.
And early on, everyone said, no, we can't do travel restrictions. People travel here. And then all of a sudden, many, many states have travel restrictions, including New York, New Jersey, Connecticut, Massachusetts, Vermont, and so on. And everybody is implementing travel restrictions because they don't want to have the disease. It would have been much better if we did that early, but surely now we need to use it as a tool, as an effective tool for stopping the outbreak, not just between states, but even within a state, so that we can get rid of the disease and go back to normal.
Yeah. Great. Well, let's go into number 5. You mentioned safe essential services.
So the main thing is that where we have to have contact between people, we want to minimize it. So this we know already, right? We want to have delivery and drive-by pickup, And if people have to go in, you have to have very, very safe conditions under which they go indoors, and if possible, to do things outside so they don't have to go indoors. Basically, really thinking through what's happening so that you don't have transmission. And some of it is general, some of it has to be done specifically for each organization. But if we take it seriously and we work together, then we can really rapidly reduce the likelihood that there'll be transmission. So that's safe essential services.
That's great. And I've seen a lot of businesses like restaurants have more seating outside. And I think
Yeah.
that's the direction of this, right? It's just if you have that type of strength available, use it.
Yeah. And again, even when you're outside, how far apart people should be and what you should have going on and so on and so on. It really matters thinking this through. And it also matters, of course, how much transmission there is in the community. You know, you can take a little bit more risk in some things, but what you really want to do is you want to take as little risk as possible so that you can get to zero, and then you can open up fully rather than kind of adding more transmission and then having to wait longer to get back to normal.
Yeah, absolutely. Let's go into safe institutions.
Yeah. So any place where you have people that are living together or get services together, so this is nursing homes, other care facilities, and prisons and particular business. You talked about safe essential services, but like meat packing, meat processing plants, so any place where you have high risk conditions, then we have to be super, super careful. And the way to be careful is to have all kinds of protocols about protecting the entry so that people don't come in that they're sick, and even having people who come in be themselves safer at home so that they don't bring in the disease, and all kinds of precautions. We have guidelines for this, but that's super important.
Yeah. Another important area is number 7, which is individual health. Can you speak more to that?
So the basic idea is that people should take care of their own health. They should do it before they get disease and if they get sick, because then they'll be less likely to get a severe case. And there are a bunch of things to do, like breathing a lot of fresh air and exercising appropriately, and all the things that you do. And in particular, things like good nutrition and drinking a lot that we know that we should do when we have when any kind of illness. And there are a couple of things that are subtle, like not suppressing your temperature unless it gets higher than like 101.5, because your body is using the fever in order to fight the disease. Even if it's uncomfortable, it's better to let it fight the disease. So those are the kinds of things that are important to know. Of course, if it does get higher than that, then you should take something to bring it
Right.
down.
Yeah, very, very helpful advice. Prevention is key, right? It's easier to take preventative measures than experience the consequences of not, right? That gets a lot
Absolutely.
harder. And the last one here, number 8, is medical system support. Can you speak to that,
Yeah.
please?
Well, the main thing is that we know that we want the best care for people who get sick, and that includes people who are severely sick, but also, of course, others. And so we need to support medical institutions and medical professionals and make sure that they're not overloaded, make sure that they have necessary PPEs, protective equipment, and other equipment that they need in order to do a really outstanding job.
Yeah, really important. And all these things can be found on the endcoronavirus.org website. Would you like to leave us with any final thoughts, Yaneer?
I think the main thing is that maybe it sounds like a lot, but it's not that many things. And if we focus on doing them, then we benefit tremendously. But you can't just do one, right? You can't just say, let's do a lockdown and everything will be okay. You really have to do these things. And then, maybe if one of them is not perfect, then maybe you're still okay. But if you pay attention and focus on all of them, then you really can do what's needed in order to get rid of this disease. And it doesn't have to take that long,
Yeah.
only a few weeks.
I have found these guidelines to be really helpful. It's called How to Win, and you can find it on the endcoronavirus.org website. Thank you, Yaneer, for sharing all this information with everyone, and for all your great work. And look forward to having everyone create a green zone in their own communities. If you like to look up information on how to do that, it's also on the endcoronavirus.org website. Thank you so much, Yaneer.
Thank you, Joaquin.